Hello, I'm Dr. Christine Goertz, Vice Chancellor for Research and Health Policy at the Palmer Center for Chiropractic Research. On August 7, 2014, the American Heart Association published a statement regarding the association between cervical dissection and cervical manipulative therapy. The statement, accompanied by a white paper on the topic, was endorsed by both the American Association of Neurological Surgeons and the Congress of Neurological Surgeons. The statement reads as follows: cervical dissection is an important cause of ischemic stroke in young and middle-aged patients. Cervical dissection is most prevalent in the upper cervical spine and can involve the internal carotid artery or vertebral artery. Although current biomechanical evidence is insufficient to establish the claim that cervical manipulative treatment causes cervical dissection, clinical reports suggest that mechanical forces play a role in a considerable number of cervical dissections. Most population-controlled studies have found an association between cervical manipulative treatment and vertebral artery dissection stroke in young patients. Although the incidence of cervical manipulative treatment-associated cervical dissection in patients who have previously received cervical manipulative treatment is not well established and probably low, practitioners should strongly consider the possibility of cervical dissection as a presenting symptom, and patients should be informed of the statistical association between cervical dissection and cervical manipulative treatment prior to undergoing manipulation of the cervical spine. Now, in this statement, the authors make 9 claims. What I'd like to do now is review these claims and ask if each is supported by the data, as in, is it true or false, and is there data to support a counterclaim? Number 1, cervical dissection is an important cause of ischemic stroke in young and middle-aged patients. This statement is supported by the data. Although rare, epidemiological studies estimate the incidence of internal carotid artery dissection at approximately 2.6 per 100,000 people, and vertebral artery dissection at approximately 0.97, or just less than 1 per 100,000 people. Number 2, cervical dissection is most prevalent in the upper cervical spine and can involve the internal carotid artery or vertebral artery. This statement is well supported by data. Internal carotid artery dissection is more common than vertebral artery dissection. Number 3, although current biomechanical evidence is insufficient to establish the claim that cervical manipulative treatment causes cervical dissection, this statement is misleading at best. It's not that current biomechanical evidence is insufficient to establish the claim, but rather that every single study designed to address this issue has shown it's very unlikely that cervical manipulative treatment causes cervical dissection. In the American Heart Association white paper associated with the statement, several studies were referenced that evaluated cervical manipulative treatment and cervical biomechanics. A small number of imaging studies have examined arterial blood flow to see if the strain placed on the arteries during a cervical adjustment decreases blood flow at a level that would cause arterial dissection. Not one study indicated that this is the case. An additional study on cadavers also showed that pressure on the vertebral arteries resulting from cervical manipulative treatment is not sufficient to cause a dissection. Number 4, clinical reports suggest that mechanical forces play a role in a considerable number of cervical dissections. This statement should not be considered evidence-based for 3 reasons. First, clinical or case reports are considered to be a relatively low level of evidence, and for very good reason. It simply isn't possible to establish a causal relationship from clinical reports. Second, we know from the biomechanical research referenced earlier that the mechanical forces associated with cervical manipulative treatment are unlikely to be the cause of cervical dissections. And finally, the term considerable number is disappointingly vague and therefore essentially meaningless. Number 5, most population-controlled studies have found an association between cervical manipulative treatment and vertebral artery dissection stroke in young patients. This statement is supported by the data. However, it completely ignores the fact that there are many events associated with VAD, or vertebral artery dissection, including major and minor cervical trauma, use of oral contraceptives, various sporting activities, stretching the neck, sudden neck movements, violent coughing or vomiting, and visiting a primary care physician. Number 6, although the incident of cervical manipulative treatment associated with cervical dissection in patients who have previously received cervical manipulative treatment is not well established. Well, we don't really have good data on how many people who experience a cervical dissection previously received cervical manipulative treatment. At the same time, it's misleading to include the term cervical manipulative treatment associated, as it implies causation. As stated in the dictionary, a correlation, or in this case an association, between two variables doesn't necessarily imply that one causes the other. In fact, the most definitive study to date, published in the journal Spine by Cassidy et al., found that while there's an association between cervical manipulative treatment and cervical dissection, a similar association exists between a visit to a family practice medical physician and cervical dissection. In other words, a person is as likely to have gone to a medical doctor as a doctor of chiropractic in the week before experiencing a cervical dissection. Since medical doctors aren't performing cervical manipulative treatment, a logical hypothesis is that people with symptoms of a cervical dissection seek treatment from a healthcare provider. Number 7, and probably low. There's no probably about it. It's very, very low. Approximately 8% of American adults receive spinal manipulation every year. We don't know exactly how many of those patients receive cervical manipulation, but it's safe to say that it's a considerable number, as in the millions. The relatively high prevalence of cervical manipulative treatment use must be contrasted with the very low incidence of cervical dissection. Cassidy identified 1,818 strokes in 100 million person years. A more recent study confirmed 388 cervical dissections within a population of 16 million people. Number 8, practitioners should strongly consider the possibility of cervical dissection as a presenting symptom. This is absolutely true. Two common symptoms are unilateral neck pain and headache. Number 9, and patients should be informed of the statistical association between cervical dissection and cervical manipulative treatment prior to undergoing manipulation of the cervical spine. By virtue of our chiropractic license, we, as is true for all healthcare providers, have an obligation to inform patients of any known risk associated with any procedure that we perform. However, healthcare practitioners also have an obligation to ensure that the information they present to patients in the context of informed consent is based on the best evidence available. Currently, the best basic science evidence available indicates that the strains placed on the vertebral artery during cervical manipulative treatment are unlikely to cause a stroke. And the best clinical evidence available shows that a person is as likely to have seen a primary care medical physician as a doctor of chiropractic in the 7 days prior to experiencing a cervical dissection. In critically assessing this response, it's my opinion that the American Heart Association statement mixes scientific facts with half-truths and misleading statements, leading people to ultimately arrive at the erroneous conclusion that it has been established that cervical manipulative treatment causes cervical dissection. By concentrating exclusively on the purported risk of cervical dissection following cervical manipulative treatment, the American Heart Association has missed an invaluable opportunity to educate patients and practitioners of the incidence, warning signs, and broad range of factors associated with cervical dissection. I challenge the chiropractic profession to step up to the plate and take on this important task. For more information on this topic or our work at the Palmer Center for Chiropractic Research, please visit www.palmer.edu/research or visit us on Twitter. Thank you.